Hi everyone, welcome back. In this video, you're going to learn about the physiology of the adrenal cortex. This is a very high yield topic. You'll see that when you're doing practice questions, there's a lot that have to do with diseases involving the adrenal cortex, and you can't really answer those questions unless you have a good understanding of the physiology of how the adrenal cortex works. So that's what we're going to cover in this video. Okay, so let's start off telling the difference between the adrenal gland, the adrenal cortex, and the adrenal medulla. So adrenal gland is the organ, and these organs, there's two of them, one on top of each kidney, and you're always going to be able to remember that because adrenal literally means above the kidneys. So they actually kind of look like hats that are sitting on top of the head of the kidneys. Now, what's the function of these guys? Well, they're glands, and glands always secrete stuff. That is the definition of a gland. And specifically, these glands secrete hormones that aren't just any regular hormones. These are critical, important hormones that are absolutely vital for life. So these are super important, and that's why this is such a high yield topic. So what kind of hormones are secreted here depends on what part of the adrenal gland we're talking about. And so if you actually grab one of these glands and you slice through it and get a cross section, you can see that you can divide it into two very obviously different layers. You have the middle layer, or the central layer, which is known as the adrenal medulla. And medulla always refers to the center of an organ. It's a Latin term for it. And the adrenal medulla secretes only one hormone, and that hormone is epinephrine. And you know that epinephrine is the main hormone of the sympathetic nervous system, so it's the one responsible for our fight or flight response. So that's the adrenal medulla, that's the central layer, that's it. Now, around the central layer, we have obviously what's known as the peripheral layer, because that's on the outside, and that's always called a cortex. So in every organ in the body, whenever we're talking about the cortex, we're talking about the outer layer that's surrounding the medulla. And so the adrenal cortex has actually is a much larger portion of the adrenal gland. So it actually has an important function in also secreting hormones, but it secretes different hormones. And all of these hormones are steroid hormones. So they're different than epinephrine because these are steroid hormones, which means that they're made from cholesterol. And because the adrenal cortex is so big, it's actually biologically divided into three separate distinct zones. And each of these zones is separate because they have different enzymes. And so they're going to make different type of steroid hormones. So we have the zona glomerulosa, the zona fasciculata, and the third zone is the zona reticularis. And in the rest of this video, we're going to learn about these different zones and their hormones. All right, so now let's talk about the different zones of the adrenal cortex and their hormones. So we have the outermost zone, which is the zona glomerulosa, and the main hormones that are made there are mineralocorticoids. And the reason that they're called that is because their main function is to regulate salt and water, aka mineral balance. And the main hormone example here is aldosterone. Then we have zona fasciculata, that's the middle zone, and the main hormone here is going to be glucocorticoids, and they're called that because one of their main functions is to increase serum glucose levels, hence glucocorticoids. Main example here is cortisol. And then finally, the innermost zone, which is the one closest to the adrenal medulla, which is in the center of the organ, is the zona reticularis, and their main hormones are androgens, which are male sex hormones, mainly DHEA and androstenedione. And then finally, a little mnemonic to help you remember the order of these. If you look at the three different zones from outside to in, we have glomerulosa, fasciculata, and reticularis. The first letter of each of them spelled GFR, as in glomerular filtration rate. So that might help you remember the order of these adrenal cortex zones. All right, so now let's talk about how these hormones are synthesized in the adrenal cortex. And first thing that you should know that's important is that the adrenal cortex is under the direction of the hypothalamus and the pituitary axis. So what happens right here is that the hypothalamus secretes CRH, which is corticotropin releasing hormone. This stimulates the anterior pituitary to release ACTH, which is the adrenocorticotropic hormone. And then the ACTH is actually what's going to act on the adrenal cortex right here. And it's going to activate this first step right here, which is a conversion from cholesterol to pregnenolone. So this is super high yield to know that this first step right here, which is cholesterol going to pregnenolone, is common in all the different zones. So these zones are going to make different hormones, but that first step, which is this conversion of cholesterol to pregnenolone, is the same. It's a common pathway. It's mediated by this enzyme, cholesterol desmolase, and this enzyme is activated by ACTH. All of this is super important. And so what's going to happen then is that once this pregnenolone is secreted or synthesized, then in each of the different zones, it's going to undergo different reactions and ultimately make different end hormones. So in the zona glomerulosa, you're going to make aldosterone. In the fasciculata, you're going to make cortisol. In the reticularis, you're going to make androgens. And then the final point here is that just like everything else in endocrinology, we're going to have some negative feedback, right? That's just part of endocrine. And the key hormone that does negative feedback in all of these is cortisol. So what happens is that cortisol is going to negatively feedback on the anterior pituitary and negatively feedback on the hypothalamus to shut things down when you've made enough of these. And so as I finally pointed out right here, the first step right here, going from cholesterol to pregnenolone, is the common step in all the zones. And then the subsequent steps are going to be different in each of the different 3 zones. And that's because each zone has different enzymes that can carry out different reactions. And therefore, they're going to produce the 3 different hormones that we have listed down here. All right, so now the only thing that's left is to go through each zone, look at the hormones that are made and the action of those hormones. And that's all we have to cover now left. So we're going to start with zona glomerulosa, and we're going to keep referring back to this figure. This looks very similar to any one of these diagrams that you see when you're studying for boards, for example, in first aid or any other resources. And so the way that we always do this is we divide the adrenal cortex into its 3 different zones. So we have the zona glomerulosa, fasciculata, and reticularis, and we have the processes and reactions that are going on in each of these zones and the product that's going to come out of it. So let's start with zona glomerulosa first, our outermost zone. And you already know that the main hormone that's going to be made here are the mineralocorticoids, and these are corticosterone, DOC, and primary aldosterone. So here's how this is going to go down. We have our first step, as always, which is cholesterol going to pregnenolone by cholesterol desmolase, stimulated by ACTH. And then this pregnenolone in the zona glomerulosa is just going to keep getting further modified until it makes DOC. DOC is going to get converted to corticosterone, and then finally corticosterone is going to get converted to aldosterone. Now, aldosterone is the main one. It's the key mineralocorticoid. That's the goal of the zona glomerulosa, but corticosterone and DOC also do have some mineralocorticoid activity, and so they can also act on those receptors. But to keep it simple, we're going to focus on aldosterone because this is the key hormone here. So what's aldosterone going to do? What's the point of making aldosterone? Aldosterone is going to get secreted from zona glomerulosa, and it's going to act on the kidneys. And it's easy for you to remember this and make this connection because this is the zona glomerulosa. And where in the body do we find glomerulus? We find it in the kidneys. So it's always easy for you to remember what was the product of the zona glomerulosa, which hormone came from there. It's going to be the hormone that's going to act on the kidneys, which is going to be aldosterone. So specifically in the kidneys, it's going to act on the distal nephron. And by the distal nephron, we mean the distal convoluted tubule and the collecting duct. And it's going to act on those channels there, and it's going to cause 3 changes. So there's 3 effects of aldosterone that you have to know. Number 1, it's going to increase sodium reabsorption from the urine back into the blood. And what's going to follow sodium? Water is going to follow sodium back into the blood. So this is going to increase the intravascular volume, and therefore it's going to increase blood pressure. So that's action 1 of aldosterone. In exchange for this, it's going to secrete potassium into the urine. Therefore, we're going to lower the serum potassium levels. And then finally, in addition to secreting potassium, aldosterone is also going to stimulate secretion of proton into the urine. Since we're getting rid of protons from the blood, the pH in the blood is going to go up as well. So there are 3 actions of aldosterone, which is increasing blood pressure, decreasing serum potassium, and increasing serum pH. This is all very, very important, high yield to know. The final point that's super important about this zone is the regulation. So the key about zona glomerulosa to know is that it is, even though it needs this baseline activity of the cholesterol desmolase to keep making pregnenolone so it can go down this pathway, the part that's really regulating this zona glomerulosa and the regulating enzyme is this last one right here, aldosterone synthase. So this is the one that is going to turn on and off to determine whether this pathway is going to keep going or not. And aldosterone synthase is stimulated by another enzyme known as angiotensin 2, which comes from the RAS pathway, which is what I'm going to talk about in the next slide. But for now, it's for you very important to know that unlike the other 2 zones, which are zona fasciculata and zona reticularis, which are only regulated by this action of cholesterol desmolase, the main regulating enzyme for the zona glomerulosa pathway is aldosterone synthase, which is upregulated by angiotensin 2. And finally, in addition to this angiotensin 2 and RAS pathway, aldosterone synthase is also upregulated by elevated serum potassium levels, and that makes sense because one of the main actions of aldosterone is to cause potassium secretion and lower serum potassium levels. So elevated serum potassium levels will also upregulate aldosterone synthase and lead to increased production of aldosterone. But the main one and the most high yield for exams to know is this activation through angiotensin 2 via the RAS system. That's what I'm going to cover on the next slide. All right, so here's a quick mini review of the RAS pathway. I have a separate video that talks about it in more detail, but for now, I'm just going to go over it briefly just so you can understand how it helps affect aldosterone. So RAS stands for renin, angiotensin, aldosterone system. So these are our key players here, renin, angiotensin, and aldosterone. All right, so here are the steps of the pathway. First, we're going to need to activate it, and the trigger is going to be a decrease in the volume in the blood vessels, so a decrease in the extracellular fluid volume, which is going to lead to a decrease in blood pressure. And what this is going to mean is that there's going to be decreased perfusion of the kidneys. This can be caused by either dehydration or hemorrhage. Whatever the case is, there's less volume in the extracellular fluid, so we have less perfusion of the kidneys. So they're going to sense this, and they're going to say, uh-oh, we have less fluid in our body. Let's fix this. And so the kidneys are going to secrete renin. It's very easy to remember that the kidneys are the organs that secrete it because the name name is in there, it's renin. So the kidneys are going to increase renin. This renin is going to circulate around, and it's going to increase the conversion of angiotensinogen to angiotensin 1. And then this angiotensin 1 is going to be converted to a different angiotensin known as angiotensin 2. And then this angiotensin 2, as you learned before, is going to upregulate aldosterone synthase. So it's going to lead to production of more aldosterone, which, as you learned again on the last slide, is going to cause sodium reabsorption, water follows, blood pressure goes up, extracellular volume goes up, and now we have return to homeostasis, and this is how the RAS pathway works. So basically, if we have low blood pressure due to a low extracellular fluid volume, this pathway is going to be activated, and we're going to have increase in the synthesis of aldosterone in the zona glomerulosa. And if that's not the case, then we don't need to turn on this pathway, and so those steroid precursors are going to be shunted to the other zones, which are the zona fasciculata and reticularis, which we're going to move on to now. All right, so let's move on to our next zone, which is the zona fasciculata. Here we're making glucocorticoids, and so what's happening is that our precursors, after cholesterol is converted, are going to go down using the different enzymes in this zone. We're going to end up making cortisol, which is the main glucocorticoid. You may have heard of cortisol. It's also known as a stress hormone, and that's because when we're under stress, cortisol levels go up, and that can help you remember some of the actions of cortisol. So cortisol has lots of different actions in pretty much every or many organ systems, but here are the top 5 that I'm going to cover here. So probably the most high yield that you should know about. So number 1, it increases blood pressure, and it's very important for maintaining a steady level of blood pressure at baseline and then increasing it in stress. And the way that this does this is by upregulating the action of alpha-1. Remember, we have alpha-1 receptors that are responding to catecholamines in our vasculature. So what cortisol does is it increases the number of these alpha-1 receptors on the blood vessels, and it also increases their sensitivity to catecholamines. So by doing that, it's going to increase vasoconstriction, and it's going to make blood pressure go up. So important action of cortisol. Less commonly, but also important to know, is that if the cortisol levels get very high, it can also mimic aldosterone, bind to aldosterone receptors, and act like aldosterone, and in that way, it can also increase blood pressure. Second important action of cortisol to know is that it can decrease serum glucose levels, and you already know this because I explained earlier that the reason these are known as glucocorticoids is one of their main actions is increasing serum glucose levels, and they do this in 2 different ways. So they increase gluconeogenesis, which means the liver makes new glucose and secretes it into the blood, and the second action is that it increases insulin resistance, so basically just it reduces the ability of muscle and fat to take glucose in from the blood into those tissues, and therefore again increases serum levels of glucose. Here's a couple of other important actions of cortisol and glucocorticoids. They decrease the immune response and inflammation, so it dampens the immune response, and this is why you're going to see that a lot of patients you see in clinic that have autoimmune conditions or chronic inflammation are given prescriptions for synthetic glucocorticoids because of this effect on the immune response. Cortisol also has inhibition of fibroblast activity, and therefore it can delay wound healing, which is something that you might see in a patient that is on high doses of glucocorticoids. This is one of the side effects of those drugs. And another side effect is related to cortisol's action on bone formation. It actually decreases bone formation because it inhibits osteoblasts, which are cells in the bone that build bone. It also reduces calcium absorption from the gut, and calcium is important for building bone. And so by these actions, cortisol reduces bone formation. All right, now let's get into our final zone, which is the zona reticularis. And remember, what we're making here in this zone are androgens. The main 2 androgens are DHEA and androstenedione. And the thing about these 2 is that they actually have pretty weak androgenic activity compared to testosterone. So they're going to have different roles in males versus females. They're going to have different action. So males already produce a lot of testosterone in their testes, and testosterone is way more potent. Therefore, these 2 androgens, DHEA and androstenedione, only have a very minor role in males. However, in females, this is the major androgen because there is no testes, there is no testosterone. Therefore, in females, this DHEA and androstenedione that's made in the adrenal cortex is actually the major androgen, and therefore it's responsible for the changes that you see in female in puberty, which is the pubic and axillary hair, as well as libido. All right, so now let's wrap up the video with a quick summary about what we learned about the adrenal cortex and the 3 different zones. So the zona glomerulosa is on the outside. It secretes mineralocorticoid hormones, primarily aldosterone. The 3 effects of aldosterone are increasing blood pressure, decreasing serum potassium, and increasing the serum pH. And the zona glomerulosa and aldosterone production is mainly regulated by the RAS pathway and angiotensin 2. Next is the zona fasciculata. This is the zone that's in the middle, and the main hormone that's produced here are glucocorticoids, specifically cortisol, and it has a lot of different effects. One of the important ones is increasing serum glucose, which is why this is known as glucocorticoid. And then next we have the zona reticularis, which is the innermost zone, so it's closest to the adrenal medulla. It's responsible for making androgens, specifically DHEA and androstenedione, which doesn't have much effect in males because they already make testosterone, but in females it's responsible for the puberty changes of pubic axillary hair and libido. And the final important point point is that the zona fasciculata and reticularis are different than the zona glomerulosa because the regulation here is by the HPA axis, by the CRH and ACTH activates cholesterol desmolase, which is the first step in all three pathways. Okay, that's it and that's all. Please drop a quick comment. Let me know what you guys think about this video and also what topics you want covered in future videos. And if you guys enjoyed this and thought it was good, please share it with others and don't forget to subscribe so you don't miss out on upcoming content. But for now, thank you for watching and I'll see you next time.